ג'מי, אתה רואה אותי? כי אני לא מוצא את עצמי.
כן, רואים אותך.
ג'מי, אתה רואה אותי?
או,
ג'מי,
כן,
אני שואל אם אתה רואה אותי.
כן.
אוקיי, כי אני לא רואה את עצמי. בסדר, מאה אחוז.
ערב טוב.
Jeremy, that you can start now. 8 o'clock. Go on.
Okay. Well, thank you all for joining. As you all know, we're living in both historic, unprecedented, and in some ways challenging and frightening times. And this is particularly the case for family members or loved ones who are dealing with memory loss or the effects of older age. So, the purpose of tonight's conversation is just to delve into those issues from various perspectives. We have a distinguished panel. We have Dr. Dana Peyer, who is an expert in dementia, who is going to be representing the EMDA Alzheimer's Association of Israel. We have Miss Yael Chaviv, who is the Director of Senior Services for the Pikud Oref, for the IDF Homefront Command, and Rav Yuval Shurlo, who is the director of Torah Neve Esrim and the Torah Center for Jewish Ethics. So if there's any questions over the course of the program, you're invited to just put them in the chat, and we'll try to get to as many questions as possible. In the event if there is an azakah, if there's a siren over the course of the program, then we'll obviously pause and resume as soon as possible. And with that, I'd like to introduce our first presenter, Dr. Dana Peer. Please, the floor is yours.
Okay. Good evening, everyone. And I'm pleased you were able to join us, and I hope the information we give you here will be of assistance to you in these challenging times and surprising times also. As Jeremy said, unprecedented, and really we don't have much of a reference. So I'm going to discuss the situation and operational things that we can do in the context of people elderly with memory loss, with cognitive decline, whether they have a diagnosis of dementia or not, whether it's someone you're caring for that may be even um, more disabled, I wouldn't say disabled, but more challenged due to what's going on around us. Okay, so usually what I do is start with the rules of do not do, and then I go on to what you should do and can do in order to facilitate and make things much easier for you and your loved one. So I'm going to start as usual with things that you should not do. Now, I'm suggesting here is definitely for our loved one, but it will also work very well for ourselves. These are caregiving, not just for others, but also to care for ourselves. And the number one thing that I suggest doing is do not watch television all the time. Do not leave the television on all day. Obviously, we're turning on the television when there is a siren, a little afterwards, because we are curious what happened, where it happened, and how it affected people in our country. But we do not want to leave the television on all day. We do not want to be watching the commentaries all day. Mostly they're just talking away to themselves, and they're not really saying something that's very important. Obviously, the sirens will go off and you will get the warning that you need. So turn off the TV. Do not even leave it on silent, because for people who have cognitive decline or are having challenges in their memory, they may not remember things that we remember. Like if today there was the siren in the morning and we saw all the destruction, sadly, and the pictures following the missiles that hit, I remember that from this morning, but when I see it this evening, I'll still remember that it was this morning. But a person with having changes in their memory may not remember that it was this morning, the day before, or anything like that, and they may get frightened anew because they think it just happened now. So we don't want to leave the TV on. We do not want to show them repeatedly clips or pictures of wreckage, of things that happened, of what the missiles did. And we don't want to share all the news, okay? There are sadly many people who have been injured and people who are displaced from their homes and people who have been killed. But we don't have to give this numbers to people who are having challenges in their memory or in their cognitive function. It's not going to serve any purpose for them. It's not going to make them feel better. It's not going to make me feel better. Therefore, I don't want to be doing this. Okay. Another thing I want to suggest is that nutrition is really good. Healthy nutrition is something that I want to do all year long. But right now, emotional eating is something I'm going to allow myself for the next week or two that it's going to be okay. So even if we want the person that we are taking care of to be eating properly and healthily and taking care of themselves, I think we should give ourselves some leeway and them as well. And if they want to eat more or less, perhaps, or if they want to eat things that normally we would say, don't eat that, or there's too much sugar or something like that, we should let go of these insistences at this time and let them eat whatever they want. Another thing I would suggest is some of the people will become more active, let's call it that. You will know by their behavior how they are feeling, and other people will become more passive, more inside themselves. So I want to suggest to all of us that we should not be constantly asking the person that we are taking care of, the elderly person, how are you feeling? Are you okay? Is everything all right? Do you need something? Because that is really irritating, okay, to the person who is on the receiving end. So I want to suggest that we are going to know how people are feeling. We're going to be able to get this information by their behavior. And even if they are more quiet or more passive than they usually are, maybe because that's the way their anxiety expresses itself, that's not that bad, okay? We know they need more time, they need more quiet. Let them be in their quiet space. Don't insist that they have to be as active as always. They don't have to do the same things that they did. All the day centers are now closed. There's really not anywhere that you can go out to meet other people in the places that we used to go. So if they just want to sit quietly in the bedroom or in the living room, as long as there's no sirens, that is fine. So those are the things that we do not do, okay? Let's talk about things that we do, or I suggest that we do. Well, I'll speak in a moment about how to get people to the safe space, okay? But I'm assuming we're already at the safe space, whatever that may be for you, whether it's the mimad or the miklat, whatever it is, the safe space, you want to have something there prepared for them to do an activity while you are waiting. Unfortunately, we are no longer able to leave after 10 minutes like we did in October, which seems so much better than it is now. But we have to wait now for the instruction that the incident is over and that everyone can leave the safe space. While that is happening, I know that for myself, I want to leave after 2 minutes. Like, I am ready to go out. I don't want to be here anymore. But my brain is working just fine, and I still have the resources to keep myself in the safe space and calm. A person who is having changes in their memory, changes in their cognitive abilities, or they're feeling stressed and anxious, they need something to do. So we have to have that equipment there. So whether it's in their personal mamad or in their apartment or on their floor or in the shelter, in a public shelter or even a building shelter, I'm sure you can leave things there that will wait for them when they come again. And people who are there will understand, especially if you put their name on it or something like that. I will give a few examples in a few minutes. I do want to suggest that we should try to get out in the sun not go for a long walk. I also did not take my usual walk today, but getting out in the sun is very important for our physical health, for our vitamin D, for our sleep-wake cycle, and also for our mental health, okay? We're very used to sun in Israel. We're people who love the sun, I think, because that's what we have here all the time. And we should try and walk outside for a short while, a short distance, what people can do also based on their physical abilities. Close to home, don't walk too far so you can get to the safe space in time if necessary. And my stipulation here would be if they want to. If the person that you are taking care of wants to go out, that's great. Go out, have a nice walk, sit on the bench, whatever. If they don't want to go out, they don't have to go out, okay? Do not get into a fight. You have to go out. You need to change. You need to freshen up. You need to change the atmosphere. That's not true. People who want to go out, wonderful. Don't want to go out because they feel that they're more secure and safe in the house, not a problem. Let them stay home. And if they're staying home, most of the day, as you have noticed, other than this morning, we've just been home doing whatnot. So I want to try and find tasks around the house for the person that I'm taking care of to do, okay? One of the things that happens is when people get to be slower, whether it's a cognitive change or physical change, motor changes, sensory changes, like they don't see so well, they don't hear so well, all these things, we start taking away the tasks that they did in the house. We say, you know what, you just sit down, I'll wash the dishes, it's easier for me, it is faster for me, I will probably do a better job, I will do the dusting, I will do the sweeping, you just sit here and relax. Okay, this is something we do early on when changes appear. And now, since we are all at home all the time, I would like to suggest that we try and get them to do more. Okay, so things that they did in the task, even if they haven't done it for a year, but they are able to do it physically, even if it's not going to come out so well, I'm going to have to do quality control and maybe redo it later. Please find the bandwidth in your heart and in your mind to let them do it. This is how people feel meaningful in their homes, through doing tasks. Having someone just sit there makes them feel useless, meaningless. They don't have a place. They don't belong to their home. And we want to try to encourage and fester in feeling of belonging. Now, regarding communications, we talk way too much, okay? This is what people do. Our brain just naturally loves stories, and we talk too much. We want to communicate short and sweet. Be succinct. You do not need to tell them everything. You don't have to tell them what's going to happen if there is a siren. You don't have to tell them what happened before and what's going to happen then, and the whole shebang. Okay, so if you want to tell them what happened with the U.S. Striking Iran, right, great, you can tell them, but give it short and sweet. It doesn't have to be the whole process of what happened and how many bombers and how many bombs. You can just give them the bottom line, okay? And you probably will have to repeat the bottom line, which is good for us that it's short and sweet because we'll also have the patience to repeat it several times. And how you say things is much more important than what you say. We have to pay attention to our nonverbal communication, what we are putting out there with our tone of voice, our facial expression, our bodily gestures. These are the things that make an impression much more than what we are saying. Now, I want to discuss the issue of how do we get people to the safe space. This is something that has come up in the past week regarding especially people with dementia, people with cognitive decline in varying degrees, because they don't necessarily understand the meaning or the significance of a siren. Even if it's going off and wailing, they'll just like, okay, I'm fine, I'm going to sit here. So my first suggestion is do not use trigger words, okay? Do not use war, missile, shelter, miklat, safe space, mamad, Iran, Iron Dome, whatever, sirens. Don't say that. Don't use it. It hasn't worked so far. It's not going to work now, okay? We're not going to be using these trigger words because all they do is might cause an oppositional stance instead of getting us to the safe space. Instead of that, I want to suggest that you try 3 options. I will give you the best one and then the other 2. Number 1 is I'm going to say, I need you to help me over there. Okay, so I'm not saying where it is and what's going to happen there. I'm just saying, please help me. Giving the person with the cognitive decline a purpose, a feeling that they are going to help me. They are fine. I'm the one who needs help. Giving them meaning. I'm going to say, I need you to help me over there, something over there. Now, I'll tell you a secret that for men, we have found out, we've been known this for about like a year, I've known this, that the best thing that works best with men is that you ask them to go and help you open a jar over there. Okay, so say, I really need your help. I need you to come and help me open this jar. It's over there. Sounds very non-feministic, but that's the way it is. The second option is I have something yummy for you over there. You have to have something yummy, okay? But something good, something that they like, a treat, whatever it is. Doesn't have to be healthy, as like I said. The third option is come and tell me what you think of something, whatever it is, that's over there, okay? It can be a perfume, a piece of clothing, whatever, okay? And it's over there. And the important thing that we need to remember is that whatever we are asking them to come and do, eat, give an opinion of, we have to have it over there. There has to be something there that they will be actually doing what we suggested to them. So if it's a jar or 2 jars, something that they can open, something that they can eat, or something that they can give their opinion of, whatever, okay? So the last thing I want to address is things that we can give people to do as activities. So obviously music is wonderful. If you can bring a playlist or something on your phone that doesn't need Wi-Fi if you're not in an area where there's Wi-Fi, or you can sing together, this is great for the person we're taking care of and obviously for ourselves. It just engages us, it relaxes us. Music is definitely a gift from God. But if we're not into singing. When I sing, that's not so good, especially if there are other people around. The other thing we want to do is try and give them things to do with their hands, okay? Something not just verbal, mental, but something to do with their hands. And for this, like I mentioned, you would have to have the equipment there already. One thing that can work with men especially is having a rope, okay? You buy a rope, which is not too thick and not too thin, and of a medium radius, and you make all kinds of knots in the rope, and you ask the person that you're taking care of, the person with cognitive decline, to untie the knots. Okay, look, oh, this happened. I need the rope. Please, could you take care of this? And now I don't care if they really untie the knots or not. I just want them to be able to do something with their hands, to feel occupied. It's a really great way to get your anxiety out because they're working hard on the rope. Another idea would be to take like a bag or a box of all the cables and the electronic devices that we have, all the wires, and put them in a box or in a bag, and they're all messy, but we all have a lot of them. And ask the person that we're taking care of, could you put these in order? Look what a mess is it. Can you just, just make some order of it. So this works really well with men because cables and electronic wires feel very manly and masculine. For a woman that I'm taking care of, I would try maybe to bring a large purse or a large bag with all kinds of items, whether it's cosmetics or all kinds of things that women have in their bags. So we have a lot of stuff in our bags. And try and get her to put things in order from the bag also. But the point is, mostly you have to have something for them to do with their hands, not just discuss and say, just wait, just wait, just wait. That's really difficult for them and for us. Being prepared will make it so much easier for everyone involved. And I'm going to end on this note.
Thank you very much, Dr. Fair. Our next presenter is Miss Yael Chaviv, who is a emotional and spiritual counselor and serves as the director of the Desk for Seniors in Picod Oref and the IDF Home Front Command. So Yael, please.
And please say that my English is not as good as Dana's or, of course, Rav Sherlo. So I apologize for my English, and I'll try to do my best. So good evening. and I'm very happy and proud to be here tonight in front of you. And I'm Yael, and I'm the commander of the Senior Citizen Desk of the Homefront Command. And it's a very big and I'll say with lots of responsibility that started, I think, a year and a half ago here in the Homefront Command. And I also I want to be fair and say that Dana is also in this in this mission, not right now, but she's a part of this wonderful group. And actually, our main goal is to listen to the needs of the senior citizens and make like adjustments for their abilities, both physical and cognitive. Um, I want to say that we're going through a really, really tough time that we've never experienced before in our country. I mean, actually, we've been dealing with this since October 23rd, and it's not easy for any of us. This situation affects the mental state of both patients and caregivers in many ways. I mean, it's a long, long time for us to deal with stress and sadness and worries, and in and also follow instructions and understand why we decide things that we decide without, for you, maybe unrational. Like why don't you say that it's 15 to 30 minutes when there's like the pre-alert? So why now it's only up to 10? So, we all the time have to adjust to new, I'll say, commands or guidelines. So I'll say that last week the Homefront Command made some new decisions that have never been made before in relation to the security situation. Like, for example, as I said, the old rule staying in the safe room for 10 minutes is no longer relevant. Now we change it to that people can come out only after they're getting the permission from the Homefront Command to leave the protected area. So it's quite like, confusing, like 10 minutes to get there, 10 minutes to sit there, and you have to deal with so many things around it. So it is kind of confusing, but I think that our guidelines are very clear. And if not, you can always call 104. This is our דנה, איך אומרים מענה טלפוני?
Hotline. Hotline.
Yeah, wonderful. And you can call it anytime and ask questions. And if you have any things that you're not sure about, you can always call us and you will get the best answer and the most professional answer. So another thing that the timing of alert has changed. Like today we send alerts up to, and I want to like to say up to and not 10 minutes. I mean, when we get the first alert, we don't have 10 minutes. We have up to 10 minutes. So we have to be very aware of what we're doing in these 10 minutes, up to 10 minutes, because it can be like 2 minutes and it can be 8 minutes, but we have to be ready. And if we're taking care of ourselves, it's wonderful. But if there's another person that we have to take care of him, and we have to take him, and we have to explain him, or any other decision that you make, it makes it a little bit harder, I think. So today we send the alert up to, again, 10 minutes. So we have to be aware and ready and prepared to go to the safety area. I'll say you need to understand that the Homefront Command's instructions aren't personalized. I mean, we give the instructions or the guidelines for all the people in Israel. The instructions, the guidelines are for 6 years old girl, or 18 years old, or 35 years old, or 85 years old. What we do in our, I'll say, desk is actually to take those guidelines and make those easier, make them easier for elderly people that dealing with cognitive and maybe physical can I say disorders, Dana? Is it okay to say disorders? Okay. Uh, okay. So the same instructions and the guidelines are for the whole country. Um, we try to make different levels of instructions as like when we speak about the safety areas. So there is one, the mamad, it's in our house. There is the mamak in our floor. There is the miklat that usually it's like underground in our building. There are safety public areas that we need to go to, and there is the stairways room, yeah, hall, and sorry, and the inner room in the house. So it's like if you can go to the mamad, go. You don't have mamad, look for mamak. If you don't have mamak, go to the miklat. If you don't have miklat, you need to go to a public shelter area. If you don't go there, then you go to the stairways. If you don't go there, then you can sit at home. But this is the last thing we want you to do because it's not safe sitting there. So we understand that elderly people, especially those with cognitive disorder, really struggle during this time because there are so many changes happening. I mean, I think that even if they don't fully understand what's going on, they can feel that something is happening. I mean, the atmosphere, the energy, the way we talk to them, the way we approach them. Um, it's in us. We're all in the same, I'll say, boat. Okay, we're dealing with stress as well, with I'll say sadness in a way, and I believe it's affect the men that we're standing in front of and trying to encourage to follow our instructions or guidelines. So our responsibility these days, I mean, I think that's maybe the basic is to follow the safety guidelines and save as many lives as possible. And, I will not talk about um, the ethical side part. I don't know how to say it correctly, but there is an ethical side, but we're in the army. We're not dealing with this. I mean, the instructions and the guidelines that we're giving to the people are we're looking at it in from one point of view. Okay, we're not saying, okay, so you can't wake up your husband, or when you wake up your wife, she's very confused and she doesn't want to go. We will never say, okay, so leave him in bed and just take care of yourself. So we will say the guidelines, and we will say that's the instructions. Do as good as you can. And I know it's very frustrating. Yeah, sorry. Um, because people want answers. People want someone, especially with uniform, tell me what to do. I want an answer. And our answer will always be save as many lives as you can. And you can take it and do whatever you feel with it. So we understand that today the blast from the missiles has a radius of up to 4 kilometers from where they hit. So the injuries are mainly um, inner, like help me, people with the
Internal.
English
Internal.
internal damages that hits. I don't know how to say it. So it's really it's killing. It's like this is our house, and if we get this heat, it really affects us, and it can kill us. And we see that the waves of the heat, I'll say, are very, very long. So we understand that today we have to follow the instruction, and it's much more I'll say dangerous to be outside or not to follow the instructions. Um, so Actually, what I want to say is take good care. I think I want to be very very, I'll say, empathy. Yeah, empathetic. I don't know. Dana, help me.
Empathic.
Um, ah,
Empathic. You're
empathic.
fine.
Yeah, sorry. And and say that I really understand you. I mean, as one person to another, from one heart to another, I really understand your difficulties, and I really understand the things that you're, even on the ethical side, are dealing with. And this I will leave to Arav Sherlo. But I really want to tell you, follow the guidelines, saving lives. And, we all agree that living here with all the difficulties, with all the struggles, with all the things that we're going through, life is worth it. So thank you very much. And I hope I did well enough. And hope we will have quiet, great night and great future, actually. Thank you.
Thank you very much, Yael. And now we'll turn to Rav Sherlo, who I believe will address that ethical side of the conversation. So, Rav Sherlo.
Shalom, everybody, and thank you for being with us and actually inspiring us to think about many aspects that we didn't think by ourselves. Also, I'll start with apologizing about my English. I don't speak English at home, and I always say in international conference that I speak the most common language in the world, and that is lousy English. So I'll do my best too, and I'll try to bring the third aspect of this meeting, this webinar, and I'm going to speak from the ethical point of view. Now, there might be, and we heard it before from the representative of the Pikud Orif, Chaviv, that it can be to contradictions. So it's a complicated situation, but I'll speak from the ethical and halachic point of view, and the decisions will be made by the audience or by the families when we are in standing in front of all kinds of situations. So let's start first of all with the pre-assumption or the default. And the main idea is that once a person, when he gets mature enough from, as a teenager and much above that, has freedom of choice, freedom of decisions. We believe in the idea that everyone has God's image, everyone was created in God's image, and he makes his decisions by himself. We can try to convince, to pursue, to press, to argue, to, excuse me, push or pull or whatever, but the decisions finally will be made by him. Definitely in the last 20, 30 years, when we're talking from the bioethics idea of the informed consent, a person must say exactly what he wants and he will make the decisions about himself. In the case of the person that has dementia, he's losing the ability to do that. And since then, we have to make the decisions, and actually, there are two values or two layers of this idea. One is that we are the decision maker, and relate to his ideas, to his wish, because it's not his wish, it's not his idea, or let's say it's much more complicated. It's up and down. Sometimes it is, sometimes it's not, but he cannot understand the entire situation, and we cannot speak about a informed consent. I want to emphasize the word informed consent, because making decisions, we know from the bioethics, is it's not enough to say, I want this or I want that. We, first of all, must be sure that the person, every time, in all ages, understands and got all the information. But in this case, when we're talking about dementia, information and all kinds of those things is not, doesn't make sense anymore. The second layer and the second factor is that the only thing that on the decisions that we should make towards him will speak about when there is a conflict between our needs and his needs. But first of all, we must understand that according to the ethical point of view and according to halacha, from now on, we are asking ourselves, what is the best thing for him? And we are working only according to these rules. He is not obligated anymore to keep mitzvot because he cannot be responsible about it. He is not obligated, is not committed to do other things, but we have to ask ourselves, we'll make the decisions as much as we can, and we'll try to concentrate only on one thing, to do the best thing for him. For instance, and this is the first, now we'll speak about 5 chapters that were the most common questions that we were asked in the last weeks that are connected between excuse me, between the situation and the people with dementia. From now on, and this is the first uh, rule in ethics. From now on, the question if it's a true or a lie is not important anymore. According to the Torah, to lie is the only prohibited thing that the Torah emphasizes. Not only don't lie, lo leshaker, but also you go and be as far as possible from lying. Midvar sheker tirchak. You should be far away from that. But this is all the way long when there's a meaning and when there is a ability to distinguish between good thing, a lie or the truth. Not only that, the halacha says that in many occasions there are situations where there are more important things than to say the truth. For instance, everybody knows the dilemma that is in the Gemara, in the Babylonian Talmud, about how to dance in front of the bride. And the halacha says, and the ethical Jewish ethics say, even though she is not the prettiest bride, and even though she has all kinds of disadvantages, we say that she is the best and that she is kalana avachasuda to every bride, because these are the principles that sometimes put the truth aside, and we have to do things that are actually enhancing and promoting the spiritual and the feelings and the ideas of the bride, and that's a principle in ethics. The same thing with dementia, a person with dementia. We are not committed anymore to say only the truth, because truth doesn't make sense and doesn't have any meaning. The only thing that we must ask ourselves is what is the best thing and for him, and what is the right thing that will make him more relaxed, more when he can cooperate with us, when he can do the good things for himself, agree for all kinds of changes or whatever. These are the two principles, as I said. One, we are making decisions, unfortunately, and B, the main issue is what's good for him. The second question that we were being asked, according to those principles, is are we permitted to give him medicine, relax medicine, without his agreement? And the answer is yes, but. The answer is yes, because sometimes it's the best thing for him. But we have to be very careful. We have to do it as minimum as possible. We have to do it only with things that will not harm him. We have to be very pure, thinking about ourselves. I mean, we should do it only if it's good for him, and not if it's good for us, yeah, and want to get rid of the current behavior. So therefore, let's give him medicine or whatever. That's not the right thing to do. But when it's good for him and when he needs it, these pills, even though he didn't agree, and even though that we are not permitted to do that to other people that have still have their knowledge and and their decisions are by their hands. In this case, you are permitted to do that. If he refuses to go to the shelter, he is in bed, he doesn't want to wake up, he refuses, what can we do? Now, this is a very sensitive issue. The orders, as we heard, and the rules according to the army is that everyone should go to be safe. And I want to emphasize something that is not connected only to people with dementia. We do have to understand that if someone gets injured, it's not only his problem. People sometimes say, you know what, something will happen to me, so what can I do? But it's also a great problem for the state of Israel, for the entire society, because, first of all, it's a kind of a victory. It's sad to say that for our enemies, but not only that, it's a lot of people will be working in order to rescue someone in order to transfer him to the hospital, and the hospitals are in a problem or whatever. So it usually we must recognize that it is a social, it's a problem of the whole society, not only personally. But in the same time, trying to do it by using power, trying to sometimes it will cause more damage to the person with dementia than to stay in bed. And the chances are really, really, really very low. Yeah, we don't have, as I said, we have to do and we have to obey and we have to do all the orders. And you will not see me taking pictures of all kinds of missiles or drones, and you'll see me immediately going into the mamad and doing everything that is according to the law. But in the case of the person with dementia and sometimes the right thing to do is to leave him alone because, as I said before, it's not good for him. All all the trying to force him, change, shock him, and all the consequences, the bad consequences that can be by trying to force him. From the other hand, and this is the most sensitive issue personally, and this is the fourth one, and more sensitive from the ethical point of view, let's say that he can't go, and we didn't succeed to take him to the shelter or to another place. Should we stay with him? And again, this is a very sensitive issue. And actually, it has three layers of decisions, making the decisions. The first thing is, according to the ethics, my life is חייך קודמים לחיי חברך. That means if I can save my life or his life, I am permitted and maybe obligated to save my life. I'm not going to explain why, and I'm not going to now to justify this principle, but this is, everybody knows it. Also, when he flies, if you remember, there's something like an airplane and flying abroad. It will come again, hopefully, but since a few months or weeks we didn't fly. So, but the security orders are that first of all, when there's a mask and you go with a child, first of all, put your mask on yourself and then put it on the child. It's very, very difficult to do it, but this is the right thing also in this case. But this is first, but when we have a mission like a army soldiers, like a fireman, like a doctor, like all kinds of those issues, they can't say, first of all, I must save my life and then I'll protect someone else because this is their job. That means also in this case, when I'm responsible and staying with him will be better and will rescue him and will protect him, then we must do that. This is our moral obligation. Third, but if there's no meaning and there's nothing that we can do, and you will not even recognize the fact that we are not here and helping him to get relaxed or and to go over the siren or whatever, so then, according to the ethical rules, the right thing to do, if there's no meaning of staying, go protect yourself, and then you'll be able to come back and take care if chas v'shalom something will happen. The last question and the last example of ethical issues actually is what to do with the foreign worker. And here I want to emphasize the foreign worker and the help that we get from him, we are committed also to their lives. Don't forget them. And they have less responsibility from us towards our parents. Towards our parents, we are like soldiers, firemen, whatever, that we are committed to save their life. The foreign worker didn't sign a contract that this is part of his job. He didn't come here in order to save someone, to rescue himself, excuse me, to risk himself and to put himself in risk in order to rescue someone else. This is not part of his job from the beginning. It will be very nice of him to do that. We should encourage him and we should support him and we should benefit him. But don't forget that it's not his commitment. So therefore, we should think about what will happen uh, if there's a siren, the foreign worker is not able to take our parent to a shelter because he refuses, because he's too sick, because we don't have a mabad at home and going down a few floors is not possible anymore or whatever. So we have to think in advance about the farm worker. Part of being moral and part of ethical behavior is not to think only about ourselves and our parents, but also about the farm worker that he's in a real problematic situation here. And it's also from the realistic point of view, it's better to take care of him because the minute if he'll feel that we are abandoning him, so the minute he will be able to leave and the airport will be open, there's a danger that we'll stay without him. So don't forget also this aspect. So if I'm trying to summarize, I'm going back to what I started with. We are responsible, excuse me, and we have to do what's good for the patient or good for our parents, for the person with dementia. And these are the two rules that we have to work according to them. Thank you very much.
Thank you, Rav Sherlow. And just on that note, we had one specific question that maybe Dr. Pear, you'd like to relate to. The questioner asks, my father is demented and has begun to be very rude and unfriendly to his worker from India. He claims he doesn't need the worker and says he wants him to leave. We're having great difficulty dealing with the situation. Can you offer some advice?
So you found out the number one secret of dementia care in times of crisis. Everything else continues as it was before. Things don't go away, behavior changes don't disappear because there's a crisis outside. Because this is a challenge that we meet every day, all over, and throughout all the stages of dementia. So I'll just give a few pointers, okay? Number one is do not try to explain to your father why he needs the foreign worker in his house. He feels like he's the same way as he has always been. He's as able and capable as he was 20 years ago, 30 years ago, and he doesn't need this guy in his house. So we're not going to try and explain or prove or show evidence of video clips, pictures, things he didn't do like he should have. Rather, we're going to try and connect with him on an emotional level, validate his feelings, say, Dad, I understand this is really difficult for you. I'm sorry. There's no other option. Or I'm sorry, I'll see what I can do. Okay. And this, you will have to keep doing this again and again. It's not like a one-time thing and then we're done. Just keep them doing. Dad, I know I'm sorry. It's really frustrating. This is not something you wanted. I get it. But for now, this is what we have to do. Do not try to go down the rabbit hole of explanations, which are logical, because they will not work. You'll be very tired and you will not have convinced him. Okay, that's like about what to do. But another thing is, do not praise the worker, the care worker in front of your father. Praise him behind the scenes, write to him notes and texts about what wonderful job he's doing, but do not praise him in front of your father as a way of gaining your father's approval, because what you're doing is actually putting your father on this little island, emotional island, which he has no one on his side. So he's not going to be friends with this person. He's going to keep being against him. It's either or. So you praise the worker in and of himself, but not in front of your father. And if it's been just a short while, relatively, since he came in, try to, set the expectation that he doesn't need to do everything, okay? The initial time when the worker comes into a person's house, we want the person with dementia, to get used to the fact that there is somebody in the house, that he's just sitting there. He can be like what I was for my teenagers. I was like a house plant. Don't talk to them, don't do anything, but they need to know that you're there. Okay, so we need the foreign worker to your father just to get used to his presence. So from my point of view, he can just sit in the living room and do nothing unless your father asks him to do something, and then he should, of course, cooperate. The expectation that somebody will come into, a caregiver or whatever, will come into someone's house and they will start taking showers and making the food and helping them change and giving them their medicine right off is not a realistic expectation. It has to be much more gradual, with a lot of getting used to. It takes time. It can take 3 months up to 6 months for a person with dementia to get used to the presence of the care worker in their house. So you have to go step by step and not try to confront him or to explain to him this is the way it is and why he needs it. Okay. And sadly, I will also say medications if necessary. If there's a lot of delusions, especially paranoid delusions, that the care worker is taking things or stealing things, we definitely need to use medications in this case.
Thank you very much. Yael, do you have any final thoughts or last piece of advice?
Well, I don't know, maybe something about life, in general, that it, it's really worth living, and with all the difficulties and the things that we have to struggle with, I think follow the instructions and the guidelines it's worth it. And every time we think that that's the lower point we could get to, and we find a lowest one. But I think we're just heading in a wonderful future, and we just need a little bit more, maybe, patience and like breathing inside and really remember the good things. And we're here for you. And 104, I'm 104. You can call us and ask any questions, and you will get any, like, all the professional answers you need from us. And good luck, and hope we have a quiet night.
Thank you, and thank you to everyone at Pico de Oref who's working under these extremely challenging circumstances. Rav Sherlow, would you like to close out the program? Unmute, Rav.
Me?
Yeah.
Hi. I think that closing the program is also important to say one important thing. We are in a historical position. Now, I'm too small in order to analyze, to understand. And I think that even all the professionals that spoke in the last few weeks, no one knew and nobody knows now. And you cannot really be a prophet in order to say exactly what will happen, if it's good, and what will be the retaliation, what here, what there. But it is a historical situation and historical period of time, and we are in big days. And I think that sometimes facing the problems that didn't go anywhere, like Dr. Perez said. And life is continuing, and the problems are still here, and the pain is here, and the frustrating situation is still here. But remembering that we actually are in the same time, are something tremendous is happening in the world. Who knows what kind of world we'll find ourselves in a year after, and when things will be over, and when the hostages will come back, we'll not forget them, when the Middle East will change, when opportunities for peace will be enabled. Well, so many things are happening. I think that it helps us also to face our problems. Now, our problems are not tiny problems. There are big problems. And when someone has a person with dementia, and it's his parents, it's not only technical, and it's not only a lot of hanging around with it, but it's also emotional and feelings, and being disappointed from the situation, and even insulted by the fact that we are not being recognized anymore or whatever. But those are big days, and when you remember that we are living in big days, I think it gives us a kind of a proportion way to look at it, and hopefully אור חדש על ציון תאיר, yeah, and we'll have a good future that is coming with us. A lot of it depends on what we are going to do with this current situation. So when you look at this way, I want to bless, and I want to pray, and I want to hope all together with all of you is that good things will come out from this current situation, and be committed to do what we must do towards life, towards ourselves, towards our parents, towards anyone else.
Thank you, Rav Shirlo, and thank you to all our presenters and for everybody for joining. Just to remind you, if you have any specific questions, you can always contact Zohar at 120, Zohar at 120. You can find them on us on Google. And best wishes for Besorot Tovot. May it be quiet days ahead. And thank you all for joining. Have a good night.